Welcome everyone to the Franklin Pierce Virtual Career Conversations. And today I'm excited to have on board with us today, Shori Dow, who is the Assistant Vice President of Strategy, Quality, and Optimization for Phoenix Houses of New England. Welcome, Shori.
Hi, thank you so much for having me.
Thank you for coming. Let's just dive right on in. And my first question, explain to us what the Phoenix House does and what do you do?
Sure. So Phoenix House New England is a behavioral health organization. We're currently sitting in 4 states, Rhode Island, Vermont, New Hampshire, and Massachusetts. And we offer a continuum of care throughout those 4 states for individuals suffering with substance abuse and mental health disorders. In our New Hampshire sector specifically, we have currently 3 programs, all at an ASAM level of care, 3.5, and then we also offer an outpatient program for individuals either residing in the communities around New Hampshire, and that we offer outpatient through individual, group, and or intensive outpatient programming if an individual needs additional support, and that is 9 hours of treatment a week. Then we also have psychiatrists on staff and nurse practitioners that provide medication follow-up and MAT services for individuals, whether that's Vivitrol and or Suboxone. We also offer MAT services and psych services throughout our residential programs as well.
Wow. This is, you're doing amazing work, so
Thank you.
I appreciate it. It seems like a really high-touch organization. So in the age of COVID-19, how has this pandemic changed the way that you all do business?
Sure. So one of our, I love Phoenix House for this because we are committed to serving individuals. So we have really, what's significantly changed is our screening process. We're maintaining and following CDC standards and guidelines throughout the states, that any of the guidance is from the governor or governors in any of the 4 states we're sitting in. But with that being said, one of the things that I will say is that we continue to have our doors open and continue to provide individuals with the services they need. The major significant change for us is all of our outpatient programs are now moving towards telehealth services. So all of our individuals, whether that be our psychiatrists, our medical providers, and our therapists are still facilitating groups, are still providing individual therapy through a video platform. So that is the major change. And in our residential programs, we're also providing that service for our psych providers as well. So that service does not stop and treatment does not stop for individuals. In our residential programs, we have had to make some changes with our group sizes. So many of our sites in Massachusetts, New Hampshire, have 49 bed facilities. So our group sizes have had to change where we would hold all what we call community meetings. Those have now changed to maintain social distancing. At times has been, challenging. All of our sites as well, all of our staff have received Phoenix House masks to allow for, again, PPE to be provided on site. And we also provide PPE for all of our residents in those facilities, whether that be our detox program in Rhode Island or throughout our residential platform throughout the other states.
It seems to me that being a first responder in this day and age has really been tough, and it has definitely changed the way that you provide your services. So thank you for being right on the front lines with all of this. Thank you.
Thank you. And, a huge shout out to my staff and our teams throughout the region, and again, specifically to the New Hampshire sector, where I directly oversee, because they're the ones that are continuing to, do the work with the individuals that we're serving.
Excellent, excellent. And it sounds to me like you really employ a wide range of employees, of opportunities, of career clusters. What are some of the opportunities that you have available right now, whether they be entry level, internships, or in the master's level?
Sure. So again, I started out Phoenix House 15 years ago, and I was an entry-level staff. We currently, and then have, worked my way through the, promotion to join the executive team. So again, we are very dedicated to the individuals that we are onboarding through our benefits packages, which I'll talk about, but also internship opportunities as well. I was able to obtain my master's degree and continue to provide the services to the individuals I was serving at that point in time. We have recovery support specialists that work directly with milieu management, meaning that they're working directly with the individuals, our residential programs, to offer direct care, behavior modification, behavior management, facilitation of groups, whether that be in-house meetings or skill-based development. Then we also have what we call care coordinators who are responsible for care development for all individuals within our residential programs. They're the individuals that are assisting with more of the care management. So basic daily needs, insurance, job placement and review, transitional planning. So beginning to have those conversations with individuals the day that they enter. Everyone is met with a care team member, and that care coordinator specifically is responsible for ensuring that we start to have those conversations of what's next for you, what is that going to look like, and then how do we support you with that. We also have care team members. We call them care leads. The care leads are responsible for the clinical development. So many times bachelor's level and above. So we do have licensed staff through master's levels, LADAC, which is our licensed alcohol and drug counselors. And we also have licensed social workers and licensed mental health team members as part of our care team. The care leads are responsible for assessments, diagnosis, treatment plan development, and providing evidence-based treatment groups for the individuals that they're working with. So the care team is really developed, we really try to do an integrated care model. We also have a medical team on site in our residential programs to provide medication management, medication oversight. And then we also have, again, as stated earlier, nurse practitioners and our medical director, who is a psychiatrist, part of that integrated care.
Wow. And so this is really about creating a team that is not only integrated, but it communicates, right, with each other about the needs for each individual that comes through your doors. Is that about right?
Well said. Yes, very much so. So again, and I shout out to the New Hampshire sector. And then we also have an access team who, again, touches every individual as the second that someone calls any of our facility, an access team member answers the phone, does an initial screen with the individuals, and then determines level of care to join that integrated care team, as you were just talking about.
Sadly, I can almost imagine that you probably have a waiting list for clients to come in, because I would imagine that mental health and drug and alcohol abuse have probably increased during this time. Is that correct?
Yeah, it is. So we're seeing a significant amount of individuals who are seeking care at this time. Our numbers have decreased a little with some of the, I think, initial scare and fear around what COVID-19 was. But specifically on our campuses, we have safety plans put into place and isolation rooms, along with, specifically on one of our campuses, isolation house, to allow, if become symptomatic, we immediately work with our local care teams to provide testing and then ensure that the individuals are safe along with the rest of the community as well.
Excellent. That is so important to not only keep your employees safe, but the clients whom Absolutely. They serve. And that's exactly what you all are doing. So I want to delve into your internship program a little bit, because sure. I know that, and I'll just ask you at this time, if you could sort of tell us a little bit about your internship program, how flexible you are. Is there some coaching involved perhaps? And I know that you've had a Franklin Pierce University student actually work for you. So if you want to tell me some things, hopefully they're
Sure.
good, about your experience with a Franklin Pierce University student.
Sure. So again, as someone who went through this process in my early career, I really value the opportunities that we can give. So as an individual is coming and joining our team, whether that be as an intern, We do also have per diem positions that are opened as part of our team.
You know,
So,
I'm sorry to interject,
no,
but the
please.
per diem positions actually are what I would consider internships,
Great.
because they are pretty, from what I know, they're pretty flexible. They're in the
Yes.
evenings, on the weekends. And I know this for a fact. I know that one of your directors at the one in Dublin actually has some coaching session and reflective time built into the per diem opportunity. Is that correct?
Yes. So if we have per diem positions open, we could be onboarding an individual because, again, our internship onboarding and our full-time hire or joining our team as an employee looks very similar. There's a requirement for a background check. There's a requirement for a physical. There's a requirement for a urine screen analysis to be conducted. So, and the paperwork process is very similar. So with that experience of bringing an intern on and bringing an employee on, we also want to give the opportunity to the individual. If you are hired into a per diem slot specifically, that would really allow you to be joining our team and beginning to get that experience through the internship, but also having a little bit more flexibility with what you are allowed to do. If you join our team in just an intern position, which is still a great opportunity, there's a little bit more boundaries around exactly what we can allow you to do. So our director, specifically in our Dublin campus, really works hard to bring individuals on for an experience to allow for individual group facilitation, individual work with the individuals one-on-one, treatment plan development, and whatever the intern specifically is looking for, we really try to specialize that experience to ensure that you can join our team full-time.
I am so excited because, well, first of all, correct me if I'm wrong, you're always looking for per diems, correct?
Yes, yes.
So that means that I can actually contact some of our students who are in some of the majors, and I want you to discuss with me some of the majors that you're looking for, who are in some of those specific community, human services majors, even criminal justice majors, maybe?
Yes. So
Okay.
a lot of our population, so we work with individuals all throughout New Hampshire, specifically with this, within the state. The individual does reside primarily in New Hampshire. With that being said, we do work with criminal justice population. We work primarily with the doorways as well, which is our primary referral source. In our Dublin campus and our Keene campus specifically, we do get a significant amount of individuals coming from the jail population.
Excellent, excellent. That's good to know. I'll be sending you some students shortly.
Please. We would love the support. And joining our team in a per diem slot would allow, again, that opportunity to be a little bit more flexible with hours. If there's open, positions and open slots, individuals would be able to be paid for that opportunity as well.
Oh, that is so good to know. Thank you. Oh, tell me about an experience you've had with the Franklin Pierce University students.
So I also have to say, when I was applying for colleges a number of years ago, it was my number 3 school, and I did apply and I was accepted. So thank you so much for that opportunity. I did go a different route, fortunately or unfortunately, but I'm very grateful for the work that you guys are doing as well. So we have had the opportunity to have interns in the past from Franklin Pierce, along with many other local universities and colleges around, and it has been a great opportunity. Again, education background and baseline that you guys are providing has been exceptional, and we've been very grateful for the quick and easy transition that was supported.
You are very welcome. We're going to get you some more of those shortly.
Thank you, please.
You got it. So my next question is, name some of the characteristics and skill sets that your organization looks for when you hire a new employee.
So some things that specifically I would be looking for, and this is something that I cannot teach and colleges cannot teach, is desire and commitment. So we're working with a very, very difficult population, and oftentimes physically sick, especially as they're coming out of detox, as they're experiencing potential some withdrawal symptoms. So it's really important that this work is very challenging. At the end of the day, I'm a human, and the individuals that we're working with are human. So it can be very draining, it can be very difficult, and it can be very taxing on your emotional well-being. So it's really important that, again, desire and commitment to work with this population. Some other expectations that I would be looking for is we provide training related to milieu management. We provide training related to the group platforms that would be offered. Again, I think that it's extremely important to have some value in working with mental health and substance use population. We also, Phoenix House is very committed to professional development. So we offer an online training platform. We utilize the Relias training platform. So if individuals do join our team, we would be looking for, say, for instance, I'm very dedicated into the dialectical behavioral. I want more training. That would be provided. Motivational interviewing, knowledge of motivational interviewing is extremely important. ASAM criteria would be also something that I would be looking for. Again, you don't need to know the intricacies of it, but it is important to have a baseline knowledge of what those are. And another very, very important skill that many individuals, especially college, is understanding what professional boundaries are. You are working with a very, again, at times very challenging population who oftentimes do not have very good boundaries. So it is very important that we, as providers and individuals working with the clients that we are serving, maintain professional and emotional boundaries.
I'm going to sort of recap what I thought I heard you say,
Sure.
just so that our audience can make sure. A desire and a commitment to be in the field and to learn.
Yes.
Empathy and active listening skills are very important. I think I heard you say.
Yes.
Along with that, a certain level of maturity, both emotional and any other cognitive maturity, that allows them to understand and to keep boundaries.
Yes.
And then you talked about the SAM criteria, which I think that Franklin Pierce, our psychology department, is teaching or is aware of. So as well as the motivational interviewing. And that is something that we teach here in the Career Development Center. It is sort of career focused in that regard, sort of human resource focused, but I'm certain that there are some elements of motivational interviewing in our psychology department as well, as in most universities, I'm certain. So I think that those are did I recap it pretty well?
Beautifully, yes.
Okay, good, excellent. So what advice would you give college students who are looking for a job in these difficult times?
Sure. So again, I think that right now, and specifically to Phoenix House, we are looking for individuals to join our team, and it's a great opportunity and a great time to join our team because we are looking to continue to provide a continuum of care for all individuals throughout the New Hampshire, Vermont, Rhode Island, and Massachusetts system. So individuals do not have to continue to remain in New Hampshire if they are looking for employment in other states. We would be very open to having somebody join our team. And something else that's really important during this time specifically is as we talk about this new norm and everybody's talking about that, remembering that this is a really difficult time. Individuals our suicide rates across the nation are increasing. And we at Phoenix House value the work that our employees are doing, but we also value the work that our clients are doing and want to continue to provide these services.
Excellent. I do appreciate you taking the time. And I know it was a very short conversation. Before we end here, can you let our listeners know, our students, our alumni, know how to connect with you, how to apply? If they want just more information, should they reach out directly to you? Is there a website, LinkedIn, whatever?
Sure. So all of the above. So our website is phoenixhousene.org. And that website does outline all of the programs across the regions that we currently are offering, and it provides direct links to any of the access teams across New England as well. If an individual is seeking employment and or more information about a specific program, they're more than welcome to reach out. along with my email address is sdow, D-O-W, at phoenixhousene.org. I'm more than welcome to answering any questions. We are also on LinkedIn, Facebook, and Instagram, and we do provide updates about careers. And then also today specifically is May is National Mental Health Awareness Month. So our company has taken pride in wearing green to work today in support of National Mental Health Awareness Month. So you will see some posts on our Instagram and Facebook later today of all of our teams who have supported this great initiative.
So is that why you're wearing green?
It is why I'm wearing green and why I have green on my face today. So yes, it's a great support and awareness nationally, but also for Phoenix House to enjoy this, New England to enjoy this platform as well.
So I thank you. I just want to reiterate, if you would like any more information or would like to apply to Phoenix Houses, you would go to their website at phoenixhousene.org. That's phoenixhousene as in Nancy, E as in Ernie.org. Or if you want to reach out directly to the Assistant Vice President, you would reach out to her at this email address, S as in Sam, Dow, D-O-W, at phoenixhousene.org. And so I want to say, you can also look at open positions from the Phoenix House by going to our internal job board here at Franklin Pierce University called Pierce Portfolio. And many of the open positions are posted in Pierce Portfolio as well. Listen, Shori, I want to say thank you. I'm going to be sending you some students, but I do appreciate what you all are doing on the front line for the United States and also for our university. Thank you so much for coming.
Thank you so much for this opportunity, and I look forward to having students join our team for sure.
You got it. Take care.
Bye-bye. Thank you.